Welcome, everyone. Today we're going to be interviewing Dr. Amy Waterman. She's a full professor and director of patient engagement, diversity, and education at the J.C. Walter Transplant Center and Houston Methodist Research Institute. She focuses on overcoming barriers to kidney transplantation and enhancing educational outreach. Through her nonprofit, Explore Transplant, she's transforming patient and provider education and transplantation on a global scale. Dr. Waterman's work emphasizes informed decision-making, reducing racial disparities, and promoting living donation. We're excited to hear how her initiatives are impacting transplant medicine and improving both access and outcomes for kidney transplant patients globally. Amy, welcome.
I'm so happy to be here. I'm so grateful for my audience and for people that are curious about organ donation and transplantation. So I really just want this to be valuable, and I'm happy to be here sharing my amazing life with transplant at its focus.
Great. Well, I have no doubt we'll accomplish that. Let's start with, this is a niche field relative to things that people are familiar with. Can you say a little bit about your pathway and how you got into the field of transplantation?
Yeah, okay, sure. So let me tell you a little bit about me, and then it'll make sense. So I'm a psychologist, and I knew when I was a young 20-something that I wanted to try to do good with that, as big of an amount of good as I could. And I had no idea what that would be. So it's like I knew I didn't want to be a clinical psychologist where you talk to one patient at a time. So I became a social psychologist, which is about building systems to help a lot of people. So I knew that, but I didn't know which system. So then I was also a poor graduate student, and I needed money because when you're a graduate student, they pay for your classes and they pay for your 10 months when you're a student, but then over the summer you have no money. So I got a job where I had the opportunity to talk to people that I'd never met before. They were living donors. And the idea was I was supposed to, as a young 20-something, call these people and ask them all the worst case scenarios. So after you donated a kidney to somebody, did you regret it? Did your friendship with them change? Your relationship? Did you have costs associated with that? Did you have health problems? So I felt like I was calling like with all the bad stuff, right? And I was doing this to cover my rent. And I had this ability, like this opportunity that's very rare at a very young professional age, where I got to meet one incredible person after another on these calls. And what I heard was that not only were these things not happening, the damage to relationship and the harm to them and the regret, but that they were telling me how profoundly important and moving, and it was one of the best things they ever did. Women who'd given birth said it was equivalent to giving birth for them. And then one woman said to me, and I'll never forget this, like 30 years later, she said, I became a poet after donating my kidney because I got what life was about. So at that point, I didn't know what life was about. I just needed to cover my rent. But the experience of hearing these people and hearing how beautiful this journey was got me very curious. And the second part I said is there anything we could do better as a system? Because that's what I'm trained to do. And they said, well, actually, yes. We had questions, but we didn't want to ask too many of them because we didn't want to be ruled out as donors. So we donated and did this generous thing, but we were too shy to ask fully what we wanted to ask. So would you be willing to build education? And I was like, I would be so honored. You're doing this charitable thing and you don't have the information that you need. So fast forward that from that moment in my 20s to now, and I've had the opportunity to speak at the White House about the need for national education for all people who are thinking about the choice of transplantation. What's it like if I donated a kidney, if I received a kidney? There's different organs that people can get. And my passion has been to kind of include people in learning. And whatever they decide to do is fine. And this year, what has been extraordinary is I thought I was done. I thought, you start with your job in your 20s and you get to go to the White House. That's good. But I actually got to go to Santander, which is in Spain, and set the World Health Organization rules and recommendations for the whole globe about how do we need to make sure that everybody makes an informed choice about transplant. So what's been extraordinary is it just keeps widening and I just keep showing up. So
Mm.
that's where it all started.
For people that aren't familiar, there's transplantation has evolved enormously, and it's a relatively new practice of medicine. Probably, I know kidney transplantation was the first transplant that was
Mhm,
successfully done. Is that
mhm.
right?
Yep. Yep.
And when was that? When was the first
Yeah,
one of
so it
those?
started in, I think, the 40s and 50s, 56 is what I believe. I could have the wrong exact year, but it started with identical twins, right? So somebody had needed a transplant of an organ, and somebody who was identical to them could give a part of their body. So you can actually give a kidney, one of your two kidneys, or you can give a lobe of your liver while you're alive. So the idea was that could we do this successfully, and could the body of the person receiving an organ that wasn't from them, could they get it? Could they do well? Do we need what kind of drugs do we need to ensure that the body doesn't see that organ as foreign and try to reject the organ? So all of that has been the science of transplantation. So can we do it? Does it work? And then when we bring organs and put them into people, and then how do we help people live long lives and manage, what this takes? So it's been starting, and there's always innovations. Where we are right now is actually talking about, I don't know if you've seen it in the news, that can you put organs from pigs in people? That's called xenotransplantation. And we're at the very beginning. We've had one kidney from a pig put into someone, and they lived for a short time and passed away. But there's a sense of how do we meet the need for organs of the people that are waiting right now.
Well, for people that don't have background, I think it might be helpful to uh, talk about the different types of transplantation options. And
Sure.
for example, somebody who has renal failure, something my mother had that, and she's actually was a transplant recipient. Um, but from the time somebody discovers that they have an organ that's failing, what
Mhm.
are the options that are available to them?
Sure. Okay. So the most common type of organ that people need in our country today and everywhere is a kidney. And the reason why for that is that people who have diabetes or high blood pressure, it can damage your kidney. So the idea is then eventually, if that goes for a long time, kidneys stop working, and you can go on dialysis, which is where a machine filters the blood that normally your kidneys would do. And so that will sustain life. You can also get a transplant from someone who's passed away. You can wait on a list, a national waiting list for that. Or you can get a kidney from somebody that you know, usually a friend or a family member, as a living donor. So there's a sense that's the first part. And most people that are thinking about transplant or considering donation are in the kidney space. But what's also very amazing is that you can also donate lobes of your liver. People are waiting for liver transplants. People who have obesity, people who their liver is damaged and needs a transplant can get a deceased donor liver transplant, or a living liver transplant. You also have people who obviously pass away and donate their heart, their lungs. Those aren't things you can do when you're alive because you need them. So there's lots of different cuts on this, but it's really a sense of what organ do you need, and then are you able to get this from someone who's passed away or from somebody who is alive, or both?
Well, let's talk about the process by which cadaver donation
Mhm,
takes place. So, people, if they've renewed their driver's license, they've probably
mhm.
seen the option of becoming an organ donor. What happens, in the event that somebody who's made that
Sure.
choice passes
Yeah.
away
Yeah, it's
unexpectedly?
great. It's a great question. So basically, many, many generous people, over 100 million, I don't know if you know that, have signed their organ. They've signed up at the driver's license bureau and said, if I pass away in a way that I could donate, I would like my organs to be available for people in need. So that's amazing. Anyone can do that. It's all wonderful. And what happens in terms of life is when people pass away, sometimes they're in situations where they can donate organs, sometimes they pass away in ways that they can't. So sadly, we don't, I wish all those 100 million could just then do that and we would solve the organ donor shortage, but it doesn't work that way. And so when people, what happens when there's a situation where somebody, for example, is at the hospital and they pass away, then there's a quiet notification that the person has communicated through the driver's license bureau that they want to donate their organs. And then there's a quiet process after we're clear that they don't, are not going to live anymore, to quickly find people who could benefit and to get the organs to those individuals. It happens within like a 48-hour period because of organs. You know, you want the organs to be functioning and healthy and getting to people. So there's a coordination of that's happening around the country. And a lot of very compassionate people are sitting with families and are having this process happen at this point where normally some families are just grieving, right? They've lost a loved one. And then there's these compassionate people who work in organ donation who are helping the wishes of the person who pass away happen. So that's another intricate part of the organ donation world.
Do you know how, for example, in the United States, about 45,000 people a year die in an automobile accident.
Mhm.
Um, do you know what percent of those people that have said that they want to donate their organ, it's able to happen?
Yeah, it's really, think about so if you're just at home and you die unexpectedly, you don't have oxygen running through your body, so you die and all your organs die too, right? So to have organ donation happen, you actually have to be in a situation where your body is being sustained with, the various things that all of the healthcare system can do so that you pass away, but the organs can be shared with someone else. And that is a very narrow group of people that are in that situation. So think about all the car accidents. So it's about quickly getting them into an ambulance. Does that make sense? Like that's what
Yeah.
it takes, because now this person we're trying to take care of them. We're also trying to ensure that if they want their organs shared with somebody, that can be maintained. Sometimes, and so it's rare, sadly.
And how many people are on a transplant waiting list today, for example, in the United States?
Yeah, so there's so I know kidney really well, so there may be people who know the other parts of this, but for kidney we have about 500,000 people who are on dialysis, and there are about maybe 90,000 people of those 500,000 that are waiting for a kidney. So they're waiting on a machine that's filtering their blood, hoping that they can get a kidney. So 90,000 kidney patients are really quietly maintaining their life on a machine and hoping for a generous person to step forward.
And how long could that time period be that somebody's on dialysis?
It depends on the area that the person waiting is living. So in California and New York, where there's a lot of people who need kidney transplants, you can wait for 7 to 10 years on this
Mhm.
list. But if you're in another part of the country with more people donating and less people waiting, it can be 3 or 4 years. Sometimes sadly it's getting longer. My job as a person who thinks at the national level is to say, what can we do to make sure every opportunity of a generous person who wants to donate their organs when they pass away or if they're alive is utilized, and that we can place more of these for the people that are waiting. Because sadly, some people who are waiting, they're just like, I'll get on dialysis and eventually my number will come up, right? Like my kidney, there'll be a match for me, and I'll move up the line. The system is fair. It's very much about the people that are in need, but then some people, they have to wait. Like I'm an O blood type and I can only receive from an O. I can give to everybody. So all the O people waiting are waiting for a rare blood type. Other people can take any blood type. So there's lots of intricacies of this, but what I would say, I always think about, if this is my mother waiting, that's like, it makes it real for me. And I guess, Seamus, we should talk about this because you had your mother waiting, right? At a
Yeah,
certain
yeah.
point. So if my mother or my father is waiting for an organ, what I want to make sure is that they are on the list as soon as they can be, if their own organs fail, and so that they can move up the list in that way. But then also that people like me, their daughter, or people that really care for them are aware that it's possible that they could get a kidney within 9 months to a year, if that I could donate my kidney to them. So I don't know what's ever right for an individual patient or their family. So I'm not here to say that, but I do want to make sure they have all the information.
Well, one of the things that I remember, my mom waited, I think, 4 or 5 years, and she had, the two types of dialysis that were available to her. One was where she went into the center and her blood went through a machine, and she chose peritoneal,
Mhm,
and which was done more frequently, but didn't leave her as tired. But she had two episodes of um, a kind of sepsis that almost killed her.
mhm,
And I remember when I happened to be with her the first time she got a call, like her call, and it was she was on two lists, and she uh, declined it. And I, of course, was like, "Oh my God, I can't believe you did this!" And I just made a big deal about it.
yeah.
And she eventually was called on the University of Wisconsin, and that's where she really wanted to go. But I just, look back on it now and wonder, like, what were her concerns that she
Mhm,
would pass on the kidney?
mhm. Yeah.
Because I can't imagine she was unusual.
Right. Well, the thing that I would say, this is actually an area of education. So I always look, okay, so your mother at that moment got a call from a doctor and said, there is a generous person who has passed away, and you are at a point in the list that you are eligible. Will you take this? Right? That's what we're doing around usually it's out of the blue, the whole thing. So the key to me is, what are the factors in which she's thinking about a yes or a no. So many people, most people just say, thank God, thank whatever I believe in, I'm going to the hospital, right? That's what we want. And we have a moment of excitement for the whole family. And so then there are people that think this isn't the right time. So I don't know, did she ever talk to you about her thinking about it?
It might have been not long after peritonitis.
Mhm.
Um,
Yeah, so she might have been felt that she wasn't strong enough maybe to go through it. The doctors would have assessed that, but for her, she was feeling maybe fragile, right? And uncomfortable. And so she's like, this isn't the time I want to add a surgery on top of however I'm feeling. It could also be, there's a practicality of this too, because she's your mom. Did you have, how old were you when this was all happening?
uh, my late 30s, I believe.
Yeah, so the key is people are evaluating like like a mom with small kids, right? Or a summer
Sure.
break or all these things. People are kind of saying, okay, is it time? The other part is sometimes people they like life on dialysis, right?
Mm.
And you go, "Well, really? They would?" But this is their community. They feel safe. They know how it works, right? We're going to shake it up a bit. So the other part that kind of happens, and I see some of my colleagues are on the call, like Charlie Thomas is a dear friend who's here, and Charlie and I is a social worker. And the key is you have a life where you know the normal of that life, right? And it's may not be perfect, but you know how it works. You've made it work, and you don't feel that good when you need an organ of any kind. So then you say, okay, you're going to go to a hospital and you're going to go through a surgery, and then you're going to feel so much better. And sometimes people are like, I don't want to rock the boat. So I think that it's really a moment of being there, being fully with people like your mom that are facing the opportunities of transplants, and also trusting in that it's going to be better. You have to see what's on the other side of it, right? So you're in it in the moment. But what is the life with a transplant? Is it better than a life without a functioning organ? And for people who need liver transplants or hearts or lungs, they don't have that choice. They can't turn it down because it's
Yeah.
their own organs don't work. And now they need a replacement or they'll pass away, unfortunately. So the kidney area is interesting because we have dialysis. So I work with people and just, be with them in the decision and really try to invite them to look into what are their options and what's right for them.
I have two friends, and I really don't want this to be about me and my experience, but I have two friends right now that are on dialysis, and both of them have had pretty significant episodes. One with clotting related
Mhm,
to the catheter, and the
mhm,
other, uh, I'm not recalling exactly what it was, but it, required extensive hospitalization, and that's not uncommon for people that are on dialysis for a long period of time, I believe.
Yes, that's correct. So basically, you're on a machine that's taking all the blood out of your body, filtering out the impurities that normally your kidneys would have done, and returning it. So you can imagine a machine is not, it's filtering out. We're grateful that it's there. That's what I always say about dialysis. I'm a fan because if we didn't have that and the kidneys weren't working and we didn't have enough kidneys to go around, there's a different thing, a lot of different things would happen. But a machine where you're only on the machine a certain number of hours a day is not the same as your kidney working 24/7. And blood coming out and going into a port can be problematic. It's having the impurities in your body over time for a long time can cause your heart to be overstressed, which can cause other types of health problems. So again, I think about my mom and I think, okay, my mom, I want to be grateful that she has dialysis and hopefully get her to a transplant. That would be my recommendation
Hmm.
for my own family.
Well, you've done a really very thorough job of outlining the kind of the world of concerns and considerations and your concerns for innovation.
Mhm.
So, and a lot of these things this was a system that was already in play when you came into the field. What for you are the areas where you focused your efforts to innovate?
Okay. So I would say, yeah, this is where I get excited. Okay. So there's a system and it's not getting enough people transplants, right? So what can we do to paradigm shift the system? So there's one level to me where everybody deserves equal access to information about this, right? You shouldn't have to come to my talk. It should just be publicly available in multiple languages. It should be simple and easy to understand. You hopefully should be able to meet somebody who has dealt with this. So if you're ever thinking, I'm a patient, I've got to face all these decisions, or what could I be a donor? We want to make sure you can go out on the internet and you can get all that information and it's trusted. It's not just somebody with an agenda. We want to say this is, national and clear and simple and true, and you choose. Okay. So my life, 25 years, has been to provide as many of those things to as all of this information to as many people in every venue that I possibly can. And it's been really amazing because the other part too is that as you do this, what I want to say is I started to just say, let's just ensure equal access to information. What happens then is the people who need the information start talking back to me, and they're even smarter than I am. So my second space is I want to listen to everybody who's facing this with as much being quiet as I can. I don't need a transplant. So I need to listen to the people who need a transplant, who want to donate organs, to say what's working, what isn't working, what we need, so that we can build a system that includes all of that. So I'd say my second area of it's not really innovation, but if I can stand in not knowing what needs to be done and I can get out of the way, and the patients and the families and the caregivers and the donors can come forward, and I can then amplify their voice as a person who's a national leader, then that will create change. So I want to help patients innovate for change and donors innovate for change. So build the education, help the people. But then the next part to me that's really cool is how do we use technology to reach as many people as possible? So I don't know where this is going to go next. Some people are on this call, but wonder what's going to happen. Like that's all. I'm always curious and I'm always a yes to these kind of things because it's like, okay, who needs to hear this? That technology can amplify the availability of this. And where can we use technology to connect with people? I think that the big fear as we move into AI and we're having a nursing shortage, for example, social work shortage, all of this. So the people that sit with people, we're running out of those people. So how do we bring information, technology, all these things to be compassionate, to add compassion to the experience instead of to strip it away? That's kind of the space where I am now, where how do we bring the love, the patience, the listening, and build it into technology so that patients feel that this part is helpful, not just that they didn't get to meet me.
Well, tell us about my transplant coach.
Okay, so this is cool. So, all right, I'm all geeked out about different types of education. And the big thing is the world of learning is become, it used to be long. Now everyone wants to learn something in a minute, right? Like we have a YouTube talk or whatever. So we built all these animations, first of all, that are like patients going through the process of transplant. And they can go through and they can watch animated people go through what they might do. So my transplant coach is an animated me or someone like me and people going through thinking about this journey. But the other part that's really amazing about it is that then you say, okay, I'm going to put in my own characteristics, my age, my race, if I have different diseases, and you can see how different choices, dialysis or transplant, could help you live longer and how long you might have to wait. So the idea is you can learn simply, and then you can kind of strategize using data that's complex to help you in your unique situation. So that's one of the tools that we have available.
One of the things that I also, preparing for the interview read was that there are very different outcomes depending on the community that you're a part of when it comes to um, access to
Mhm.
organ transplantation and just the success that people have. What are the variables there?
It's okay. So the first two different questions. So access is about were you offered the opportunity to receive a transplant? Right? So to me, standing in fairness of the healthcare system, everyone that does not have a functioning organ deserves to get all the information and then they need to be offered this. What we're seeing is depending on people's ability to speak English, as a simple example. The providers don't know how to explain it in Spanish in our country, and they then give them minor information the patient doesn't understand. The other part is that maybe a whole family needs to listen in on learning, and we didn't talk to the whole family. So now someone who's sitting on dialysis every day, we didn't involve all the people who help them make decisions, right? So that's where you start to see access problems. The other part is it gets very practical. So does somebody have a car to go to the transplant center? Does somebody have $20 to pay for the parking for the evaluation? So now we're talking about economic challenges that vary in our society. So you look at the very much the practical things. People who live in rural areas, most of the transplant centers in our country are in urban areas. So it's I'm watching trends of where people aren't getting access, and many good people in our field are trying to overcome these barriers. So that's that part. Again, using technology, what if all this information could be fairly given out? There's a national transformation of organ donation happening right now, which is really exciting, called the Modernization Initiative. And one of the tasks is to build a national website in English and Spanish of health literate resources for all. So I'm really a stand that is here and excellent. So that's that side. Now you move to outcomes. Okay, so outcomes, again, are touched by the same thing. There are people so if you have a surgical experience and then you recover, what do you need? You need the ability to pay for the medications. You need the ability to have people who love you and support you as you heal, right? You need to have the knowledge about what you need to do to maintain your health. And those things are often inconsistent depending on the patients that we're taking care of. So again, on the post side, you don't want people to leave their surgery and not have what they need and have to come back into the hospital, right? You want them to leave empowered. So an example of something that we're doing is we're bringing virtual, like telehealth. So something like this, we're upping telehealth so that somebody can be at home having questions and we can help them. Another thing we're doing that's totally geeky and fun is I'm working in our hospital and we have something called a bio button. Okay, it's this big, it costs $3 and you stick it on you. Okay. And at the hospital now, it's doing all the things you do when a nurse would come in at 3 a.m. and say, okay, we got to check all your vitals. The button can do that all the time so the patients can sleep, right? And that helps them heal. You can send that button home with someone. And now if they're having a fever and you can see that based on their vitals, or because they can be ongoing monitor that, we could call for telehealth and say, hi, it looks like you might be spiking a fever. Let's try to take care of you. So again, technology trying to improve the healthcare experience.
Hmm. Well, one of the things that's really clear is that you've been dealing with a pretty lengthy and very complex challenge. And I'm curious, one of the commonalities of people that are on the Difference Makers series is participation with Landmark. How has your participation with Landmark supported you or come into play
Mhm.
in the work that you do?
Yeah, so I'm in many, many ways. So the first part is I would say that in being a Landmark graduate, I was creating what I wanted my life to be. And I didn't just say I wanted to be happy and I wanted to get a job. I actually thought, could I take on something so big and stand for it like consistently and become as expert as I could so that I could make the world better. That was my at 20 when, mostly I just wanted to not be a graduate student anymore and make more than $10,000 a year, which is all the reality of that moment that I shared at the beginning. So did I ever think in a million years that I would be guiding the healthcare recommendations for the World Health Organization? No, I didn't. The other part was that I got that who did I need to be? So I needed to be able to public speak. I needed to be able to listen. I needed to be able to, do things that were hard. When you make a big difference there, it's not like you fall out of the, you leave your graduate school experience and you're ready to do that. So the level of training and I owned what I was up to at an early age, and then I just showed up for all the opportunities that Landmark had about, how do you present to other people and how do you not make it about you and how do you, um, what makes you influential and effective and where do I need to let go of things that aren't that? There's a certain, to me, I am so clear that I am standing in a space of goodness in organ donation and whatever happens is going to be I'm a droplet in that space, hopefully maybe a cup of water, but still we're all in this space together. And so my job is to have more people join in this space with me and to pour their cups in the water together. And I've gotten to be humbled and moved and to grow like crazy. Someone asked me, I was in a memoir class and I was writing about how extraordinary this field is. And she's like, why, like mostly people don't talk about their career as being extraordinary. They talk about their kids. Do you know what I mean? Like, why are you talking about your career? And I was like, it feels like a family. It feels like to be in a cause that is so big and to get to grow in it and to fail and succeed. Most people have seen me do well and then screw up because I'm out there pretty visibly. But to become fully who I am, I think the answer, whether it's I've had a lot of training now. I have a spiritual director. I'm a psychologist, so I have a psychology a coach for 20 years. I have my Landmark training. All of those things helped me show up in this space to be there for patients at a moment of vulnerability in a profound way. And what I would say for anybody who is kind of thinking about a big game, it's not, you're not enough. It's going to take a village that has your back. I've had Landmark coaches, senior coaches who said, I like what you're up to, and I'm going to bring my skills to help you be successful. So I'm really grateful for many different Landmark coaches who've had my back, lots of training programs. So knowing that it's not going to be enough to just have it be about you, but to surround yourself with powerful advocates to train and develop you, and then just to go for it is what I would say Landmark taught me.
Hmm. Well, as you look forward, in the next era for you and transplantation, what are the needed innovations, and where are you going to be focusing your efforts and energy?
Yeah, thanks. Great question. So I would say, first of all, I think about, or we have organs being wasted right now. Good people pass away and they donate organs, and then those organs, we can't find a match for the patient fast enough. So to me, I'm really present to the loss in that moment of the families that are waiting that didn't get their organ on that day. So there's a part for me of how do we make sure the deceased donor gifts are fully utilized. The second part is, can we invite more people to consider being living donors as kidney donors? This has been a cause of mine forever, but the thing that I want to say is, unlike lots of healthcare areas, we could literally eliminate the waiting list for people that are waiting for kidneys if 90,000 people would donate one kidney. Okay, so we've got 315 million people in the United States. And I'm kind of like, I know there's many more than 90,000 charitable people. And so they probably, and you started with saying it was a niche, area. I just think they don't know. So how do we use communication vehicles? We're building media campaigns. We're learning what does resonate for the person this doesn't directly touch their life. Do people know that you can donate a living donor kidney? Like, I think that's interesting, right? People ask me very early questions, where somebody asked me, is there a freezer where all the organs go when people pass away? No freezer. So and that's not a dumb question. I can get it, right? I have a freezer in my house. Wouldn't it be great? We just stack up all the kidneys available. But no, we have a 48-hour window where we have to get these organs to people when they pass away. So a lot of this to me is general communication to the public, also giving a safe space for people to ask questions so that they don't feel that I want access for everybody for information, and I don't want anyone to ever feel stupid, because it's a medical thing, right? That does tremendous good. So how do we let the medical questions be asked?
Hmm. Hmm. Well, I really, really thank you for spending your time with us today, and thank you for all the work that you're doing. And personally, it's touched my life, and I know that it touches the lives of hundreds and hundreds of thousands of people, both patients and their families. And it's just wonderful to know that you're out there innovating.
Yes. Well, you know what? Thank you, first of all. And what I get is, when I hear your mother benefited from transplant, that's what my entire life is for, that you benefited having your mother. So it's like that, if this helps anybody in that situation, that's what I get to be moved by. Patients keep me grounded and humble, and they are dealing with so much, and they teach me so much. So I get this incredible world of learning it makes me a happier person, a grateful person. So it's always a feeling of, it's an honor to be in this field and to do good. And if I can keep, spreading the word and it helps people, great.
But really, thank you very, very much, Amy.
Yeah, you're very welcome.